computer. Hi, my name is Dr. Mary Doctor, and I am from the University of Mary in Bismarck, North Dakota, and I would like to introduce Emma Ulmer, who is a 2020 graduate of the University of Mary, who was a co-author on a study entitled Comfort Level of Current Physical Therapist Students in Addressing Sexual Issues with Patients. So Emma, why did you and your team of co-authors, why did you decide to study this topic?
Yeah, as students in our grad program and talking with our classmates and, taking the courses and the classwork, we realized that a lot of students in our cohorts were very uncomfortable talking about sexual issues with patients. And knowing the impact that health conditions have on sexuality makes it a fundamental component that we need to be able to discuss with our patients. And so knowing a little bit about that and the topic of sexual issues and that being uncomfortable for people, we wanted to really dive in and research more on that topic itself.
So there were 3 programs that were included in your study sample. Why did you choose these 3 programs?
Yeah, so with our survey, it was a sample of convenience as far as all of the co-authors. And so we had co-authors in each one of the programs that we surveyed, but it also allowed us to expand our demographics a little bit more. So the 3 programs were all 3 private universities, but they're in different geographical locations in the United States. And they also had different religious denomination affiliations with them. And so that helped us expand the demographics a little bit more.
So what did the results tell you?
Yeah, so similar to other previous studies that we had looked at, our study showed that 37% of students who responded were uncomfortable addressing sexual issues with patients. And then in general, it also showed us that students are more comfortable addressing sexual issues with female patients versus male patients. And then finally, we realized that and found that comfort level in addressing sexual issues was independent and not associated with the location of the education program, gender, religious denomination, race, geographical location, and year in school that the student was in.
What surprised you the most from the results?
I think one of the things that surprised us the most was going back to what we hypothesized at the beginning of the study, that religious denomination and personal values would have a significant role in student comfort levels, and it showed that it didn't. Another interesting thing that we found in one of our open-ended questions is that there was a few students that reported that addressing sexual issues was not related to the physical therapy practice. And so that was really surprising to us because we do have, sexual education and women's health education implemented into our programs. And so whether that's a lack of education in the program or a lack of knowledge of what the scope of physical therapy practice is, that definitely needs to be addressed as well.
And finally, Emma, why is this study important for educators, whether they be in the academic or in the clinical setting?
Yeah, I think this is a very important study for educators, for all students, because overall, when we looked at barriers that were addressed in this study, lack of experience was the most frequently reported by physical therapy students. And so yes, lack of knowledge and didactic education was also a barrier, but students aren't feeling like they have that hands-on experience to be able to go out and be clinicians that address sexual issues. And so maybe this suggests that adding in simulation into the didactic education and allowing PT students to have the hands-on experience that they need to gain the confidence and the comfort levels is needed. And that's an area where education and educators can help students.
Well, thank you very much. And we hope that anybody watching this video will go on to read the full results in the article.